Welcome to the Palmer College Gross Anatomy 1 palpation videos for the lower extremity. Video participants are Dr. Tom Brozovich, videographer, Dr. Michael Opelt, depicting the doctor, Dr. Michael Vanetta, depicting the patient, Karen Anthony is the narrator, and John Brozovich also participates in depicting the doctor in some of the videos. First lab to be covered is Lab 8, the pelvic bone. First lab to be depicted yet is going to be Lab 8, the pelvic bone, femur and patella, gluteal region, posterior thigh, and popliteal region. First, the bony features. Anterior superior iliac spine is one feature. Crest of the ilium, iliac tubercle, posterior superior iliac spine, ischial tuberosity, greater trochanter, medial and lateral condyles of the femur, medial and lateral epicondyles of the femur, and the base and apex of the patella. First feature we will cover is going to be the crest of the ilium. Palpate the lateral aspect of the hip. It is usually going to be located around the belt line. Palpate laterally and slightly superior and work your way around posterior to palpate the crest of the ilium. Second feature is the iliac tubercle. Find the highest point on the lateral aspect of the iliac crest. This is often at the pant seam if the patient is wearing pants. Next feature, anterior superior iliac spine, often referred to as the ASIS. This is going to be the most anterior point on the crest of the ilium. Often find the crest and work your fingers anteriorly. Next feature, posterior superior iliac spine. This feature is located at the most posterior aspect of the iliac crest. Ischial tuberosity is the next feature. On the skeleton, the ischial tuberosity is located at the pointer. On the patient, this is going to be the bony prominence you sit on. Have the patient flex the femur at the hip joint, palpate at the mid-gluteal fold area, apply some digital pressure for credit on this feature. Next feature is the greater trochanter. On the skeleton, the greater trochanter is this feature. On the patient, locate the iliac tubercle at the high point of the iliac crest and then drop down approximately 3 inches, this will vary some, to locate the greater trochanter. Have the patient rotate their femur to feel this prominence move if you are unsure of your placement. You should feel a bump moving underneath your fingers if you are on the greater trochanter. Next feature is going to be really 2 parts of the patella. This is going to be This bone here, right at the top, is the base, and at the bottom point is the apex of the patella. So there's two features to identify with the patella. On the patient, you're going to have the patient sit, so they're bending their knee while sitting. The base is going to be the superior flat portion. The apex is the pointed inferior portion. Then the next features are the medial and lateral condyles of the femur. Once again, have the patient sit down with their knee bent. Find the base of the patella. Go slightly superior and medial for the medial condyle, and slightly superior and lateral for the lateral condyle. Medial and lateral epicondyles. Again, the patient should be sitting with bended knee. Find the condyles of the femur. The epicondyles are slightly superior and medial for the medial epicondyle, and slightly superior and lateral for the lateral epicondyle. That is it for the bony features. Now we are going to move for the muscles. The first muscle on the list is the gluteus maximus. To palpate, touch the buttocks. There are two possible tests for this muscle that you can use. One test is going to be to extend the leg while touching the buttock, or you can have the patient clench their buttocks together while palpating. Next muscle is the gluteus medius. You are looking for the superior portion of the gluteus medius because much of this muscle is covered by the gluteus maximus. To palpate, go slightly above and lateral to the buttocks, or the gluteus maximus. To test, have the patient abduct and medially rotate their femur. That's the gluteus medius. Next feature is really a nerve. It's going to be the sciatic nerve. You will need to identify two landmarks this nerve is going to be between, and then palpate the midpoint. This nerve is deep, so you're not going to be palpating the nerve directly. The landmarks are the greater trochanter of the femur and the ischial tuberosity on the pelvic bone. Go halfway between, touch the halfway point. That deep to that is where the sciatic nerve would be located. Tensor fascia lata. To palpate this muscle, go to the lateral aspect of the thigh between the greater trochanter and the iliac crest. To test, have the patient abduct and medially rotate their femur. Next muscle, biceps femoris muscle. We will be palpating the tendon of this muscle. To palpate, go to the distal lateral aspect of the posterior thigh. To test, have the patient flex and laterally rotate their leg toe out. A sharp tendon should become obvious. On the medial aspect, we are going to be palpating the semitendinosus. Again, we will be palpating the distal portion of this muscle. To palpate, go to the distal medial aspect of the posterior thigh. To test, have the patient flex their knee and medially rotate toe in this time. This is one muscle that will be checked, so you need to be on the sharp tendon. The next muscle is in the vicinity. It is the semimembranosus. We are again palpating the distal portion of this muscle, but this muscle is deeper than the semitendinosus and broader at this point. To palpate, find the tendon of the semitendinosus and go slightly medial or lateral when the knee is flexed. To test, have the patient flex their knee and medially rotate toe in their leg. Next is actually an artery which you're going to be taking a pulse, the popliteal artery. Have the patient flex their knee, press firmly into the middle of the popliteal fossa, and try to detect a pulse. You must press firmly to obtain credit, since the artery is deep to the vein. This concludes Lab 8 for the palpation videos.